The number one sexually transmitted infection in the United States may actually surprise you. In fact, it is the infection oftentimes people know the least about, but is way more common than we even realize. So today we're going to talk about human papillomavirus. It is the number one sexually transmitted infection in the United States. And what's really interesting about this particular infection is that for most people, it doesn't cause any symptoms. Now, do you understand why it's the number one infection in the United States of sexually transmitted infections? So for this reason, it is very hard for people to determine at what point in their life they acquire the infection. In fact, from the time of exposure to the time of becoming known of the infection or developing some type of HPV-related disease, it could have spanned years or even decades. And this is what makes it so difficult for many people to accept when they are first finding out that they are infected with HPV. In matter of fact, they could have acquired HPV from a relationship many years ago or multiple relationships ago. So that's what makes it hard. However, let it be known that human papillomavirus can affect both male and females. We oftentimes associate it with females because it's the only group that is actively screened for HPV. And HPV screening is done in the older women. It is not done in adolescents, it's not done in men, and it's not done in our young adult females. It's only primarily done in the over 25 group, or depending on which guideline your clinician is following, or over 30-year-old females. Now, what's important to know about HPV that's oftentimes a little bit hard to conceptualize is that the human papillomavirus, we really should be saying human papillomaviruses because it's really a family of viruses. In fact, it's estimated to be at least 150 to 200 strains of HPV. You heard me correctly, 150 to 200 strains. 40 strains alone have been known to affect the genitalia. And at least 14 strains are considered to be high-risk HPV. And we'll talk about what high risk means. But before we go there, so there is a family of HPV viruses, and they all have various numbers. And we kind of learned the concept of different strains, especially as a result of the pandemic, as we learn that the coronaviruses have multiple strains of coronaviruses, right? And so apply that same logic or that same concept to HPV. There are multiple forms of HPV viruses, or multiple strains of HPV viruses. There's only a few we're most concerned about. So HPV viruses, if someone were to become symptomatic, and as I mentioned, developing symptoms may be far away from the time of exposure. Exposure typically happens as a result of sexual contact, and sexual contact can occur orally, anally, or vaginally, or can be from close touching of skin-to-skin contact. So skin-to-skin contact, and in some cases, even the sharing of sex toys can cause the transmission of the virus. And this can occur as penile to anus, penile to vagina, oral to vagina, oral to penis. Name the combination, any type of intimate, close skin-to-skin contact can result in the transmission of HPV. As mentioned, men are not typically screened for HPV, but it doesn't mean that men are not affected by HPV-related diseases. So low strain HPV is commonly the strains that will cause genital warts. In fact, 2 of the primary strains, 6 and 11, are known to cause the majority of genital warts, whereas 16 and 18 are the most common strains known to cause the far majority of HPV-related cancers. So where can cancers actually occur as a result of HPV? Well, we know that historically that HPV-related cancers can occur in the cervix. And we actively screen for cervical cancer. So why are we screening for cervical cancer? Well, one, we know that if cervical cancer is caught in early stages, and ideally in the precancerous stages, then we have a good chance of curing that person and preventing the progress of disease. We also know that cervical cancer is common enough that it would make a great impact to have a screening program, whereas for other cases of cancers, they're not as common. In fact, HPV causes about 3% of cancers in women and about 2% in men. In men, HPV can cause penile cancer or anal cancer or oropharyngeal cancer. In women, HPV-related cancers include cervical cancer, vaginal cancer, vulvar cancer, that's the outside of the genitalia, anal cancer, as well as oropharyngeal cancer. So oropharyngeal cancers typically occur in the back of the throat, around the tonsillar area or the base of the tongue. This is why it's so important to use protective devices or barrier methods to prevent the transmission of HPV. HPV can be transmitted, as mentioned, primarily through sexual contact or close skin-to-skin contact. We can decrease the rate of transmission with the use of barrier methods, including the use of condoms, as well as the use of a dental dam. Dental dam is the covering on material that's either latex or polyurethane that can create a barrier of the mouth of the person that's performing oral sex to the genitalia of the other person, or in some cases, the anus of the other person. So that being said, what else can we do to decrease the risk of infection with HPV? Well, the vaccine is another option. Well, the vaccine is available for our preteens and is recommended for anyone up and through the age of 26. However, it is still available for those who are ages 27 through 45 years old and should be provided on a case-by-case basis. So why isn't it recommended for the older group? Well, simply because it's believed by the time women and men are in that older group or in that older age group that they've likely already been exposed to HPV. And so the benefit of the vaccine is considered to be less in that particular age group. But in some cases, it can still provide a substantial benefit. Now, keep in mind that the vaccine protects not just against all the cancers that we mentioned, but also against genital warts. A common question that's often asked in the office is, if I've already been diagnosed with an HPV-related disease, for example, an abnormal pap smear, does it make sense for me to go ahead and get the vaccine if I'm in that recommended group? And the answer is yes. And the reason why is, though someone may have been exposed to one strain of HPV, the vaccine inherently protects against a total of 9 strains, 2 that are targeting the low-risk forms of HPV strains, which are responsible for genital warts, and 7 that are high-risk strains that are linked to the majority of cervical cancers. So do we know whether or not the Gardasil vaccine even works? And the answer is yes. The Gardasil vaccine was introduced in 2006, and since then, there have been multiple surveillance studies looking to see whether or not it's effective. In fact, not just in the US, but internationally, it has been shown to significantly reduce the rate of cervical cancers. So there was one large study that in fact showed that the reduction of cervical cancer in young women was as high as 90% as a result of the vaccine. So we know it works. It's been on the market for a long time, and the results are great with a very low side effect profile. To be clear, it's not just recommended for women and girls, but it's recommended for men and boys just the same. Even though there is no screening tool for men, the reduction of men and boys carrying the infection can ultimately also reduce the incidence of cervical cancer indirectly. But also, as mentioned, cervical cancer is responsible for the majority of vulvar, vaginal, penile, anal, and oropharyngeal cancers, in addition to cervical cancers. So reducing the transmission or the rate of HPV can ultimately reduce these other cancers as well. And keep in mind that even though there is no screening test for men, it is believed that there's a high rate of HPV transmission for men who are recipients of anal sex. Another very important thing to know, and this is for my women specifically, keep in mind, so one of the point of confusion always is, Does a pelvic exam always include a pap smear? And the answer is no. In fact, unless you've had an abnormal pap smear in the past, your frequency of screenings is not going to be annually. So if you're getting an annual exam, it likely does not include a pap smear, or you should ask your provider just to make sure you know exactly what your exam included. A pap smear is just merely a very small part of the exam. And in fact, a pap smear is simply the part of the exam where the cervix is viewed and the cervix has an opening, and a brush or a spatula or another type of device will be inserted into the cervix, and it will be collecting cells on the outside, on the outer cervix, as well as cells just on the inside. So a pap smear, it can or may not be a part of your pelvic exam. So making sure that you have some clarification on that. And sometimes we will do a pap smear exam only and not the other aspects of a pelvic exam, depending on the indication for that visit. Keeping in mind that women who undergo pelvic exams on an annual basis may not necessarily be undergoing a pap smear. And I just want to make sure that that's very clear. The routine screening, depending on what screening methods are being used, which also is based on risk factors and age group, but it's going to be anywhere between every 3 to 5 years, typically, for routine screening for cervical cancer. It is not going to be less frequent than that unless someone has a history of cervical dysplasia, which includes precancerous or sometimes a history of cervical cancer, and they're undergoing continued surveillance. That group of women will experience a higher frequency of pap smear screenings. The other important thing for individuals to know is that every time we have a new partner, we can potentially be exposed to a new strain of HPV. So keep that in mind. So that's why it's really, really important to continue with your routine screening. The far majority of women who have precancerous lesions of the cervix will not have symptoms. And if they do have symptoms, it's usually very nonspecific symptoms, which include like irregular spotting or bleeding, which, as you ladies know, can be caused by just a number of other conditions. And so it's very important to continue with your routine screening, because the whole point of doing a screening is because you're trying to monitor for a disease that lacks very obvious symptoms, or in most cases, lacks symptoms at all. And ultimately, our goal is to prevent the progression to cervical cancer. Because the rate of penile cancer is so low in men, there is no current recommendation for screening men, as was previously mentioned. So I hope this cleared up some very fundamental but key information about the HPV virus, human papillomavirus, not to be confused with HSV, which is herpes simplex virus. They have some commonalities in the sense that they can lay dormant in the body and cause symptoms at a later time, but they are very, very different. One can lead to cancer and the other one does not lead to cancer, but can lead to bothersome symptoms. The key, again, is for no one to be embarrassed or ashamed about having a sexually transmitted infection. We want to make sure that that's very clear. This is about gathering the information needed to make good decisions about your sexual health. And as mentioned, there are things that we can do to decrease our exposure rate. Certainly having sex at an earlier age increases a woman's exposure. Having multiple partners or a partner who has a lot of previous partners or current partners will increase a woman's rate or risk for having HPV. We know that using barrier methods also decreases the rate. And as mentioned, being immunized against HPV is another layer of protection. So that being said, our goal here is for everyone to have and feel empowered about your sexual health, your intimate health. There is nothing to be ashamed about, but we do have a level of responsibility in order to protect ourselves and our partners. We are here to provide the information that you need to make the right decisions. And I hope that this information has been helpful to you and have cleared up some myths about the human papillomavirus. Again, it is the #1 sexually transmitted infection in the United States. It is very, very common, tends to be asymptomatic, which is why it's so easily spread. and however, can have very devastating effects if not closely monitored because of its link to various cancers. We hope that you will also check out some of our other videos that go into details about other forms of STIs. And STI, to make some clarification, may be confusing some folks, like what's an STI versus an STD, but an STI is really just the infection itself. And the majority of sexually transmitted viruses and bacteria are just that, infections. But once they go on to cause other symptoms, they become diseases. And so the far majority of a lot of these infections do not cause diseases. In most people, they're either asymptomatic or have very minimal symptoms. They're preferably called sexually transmitted infections as opposed to diseases. But once they do and are linked to some form of disease, then they're called STDs. And I hope that didn't confuse you. Oftentimes we use them interchangeably. Definitely don't feel like you need to follow any guidelines. I just wanted to make sure that you're clear that when I say STI and STDs, we're pretty much talking about very similar things, the same things. In fact, and once again, this is Dr. T, the hand behind the handle of Healthy Bump Club here on YouTube, and the hand behind the handle of Healthy Bump Club on Instagram. We thank you guys for supporting us. And if you're wondering, how can I support this platform and want to hear more information, then I'm glad you asked. You can support us in one of three ways financially. One, you can check out our link below and go to our shopping link for our apparel line called HBC Village, which you'll see in a few moments. Or you can check out, I almost forgot, there's actually 4 ways. You can check out our fertility video. If you're interested in family planning or you're preparing to have a baby, we have a very comprehensive fertility video. And also you can go ahead and use our other link because we're Apple partners. So whenever you're ready to purchase some Apple Music products, make sure you use our link. Because why not? You're purchasing the product anyway, and using the link helps to give us a few coins, which helps us to support and continue to support this platform. Or you can reach out to us directly if you desire to donate directly to us. Whatever method of support you use, we absolutely appreciate it. Before you go, make sure you comment, like, and share our content so that we can get out further in the virtual world. And when you're done there, we would love to see you back for our next episode. So just make sure you stay tuned. We have some great topics coming up. And this again is Dr. T, and I'm signing out. Thank you guys for watching, and we'll see you in next episode.